has the 5th largest number of people living with HIV in the world, and HIV continues to be a leading cause of adult morbidity and mortality. To tame new infections and deaths, the government has adopted a test and treat strategy where those diagnosed with the virus are started on antiretroviral therapy. But over the years, the government has grappled with a shortage of these life-saving medicines, a perennial crisis it hopes to address by locally manufacturing these medicines. My name is Dr. Mercy Korir, and on this episode of Health Digest, Gloria Milimu takes us through what it takes to manufacture these medicines locally.
Antiretroviral therapy is one of the most effective tools available and is often considered an essential part of an efficient, sustainable HIV/AIDS response. With a population of 1.3 million adults and 139,000 children said to be living with HIV in the country, experts say an efficient supply of these life-saving medicines is key to achieving zero new HIV infections, reduce the risk of tuberculosis infection among people living with HIV, and zero HIV-related deaths. But more often than not, the supply of these vital drugs has not been steady, posing a threat to the well-being of people living with HIV and rolling back decades of long gains made in the fight and management of the disease.
There's overwhelming evidence to suggest that, we need an interrupted supply of ARVs in the country. And this is at different levels. So on one part is that, the evidence is clear that the antiretroviral therapy is useful in terms of, saving life and also improving the quality of life for people living with HIV and AIDS. So that evidence is quite compelling, and therefore, there's every reason to put everyone who needs treatment on the right treatment. So that's the first level. Then the second one is about looking at ARVs as a public good, in the sense that the benefits of ARVs goes beyond the individual patient or the individual who is taking the medication, because with the ARVs you reduce the viral load, and therefore you also reduce the extent of transmission of HIV and AIDS from one person to the other. So there is, benefits beyond the individual. There is a benefit to the public by putting whoever is infected on treatment. So that public good is of utmost importance, and it's the same way we look at vaccines, for instance, that by vaccinating someone, you're protecting beyond that individual, and you're also protecting the general public. So that's the second level. The third is in relation to global health security. And what do I mean by this? I mean that the treatments, the ARV treatments, are only useful if the virus is not resistant against them. So for instance, if you have patients on a first-line treatment, you want to keep them on first-line for as long as you can and avoid a situation where the virus is resistant to the treatment, and therefore you need to transition the patients to either second-line treatment, which is often more expensive and probably with a lot more side effects. So we need to keep the viral resistance to the therapies to a minimum. And one way to do that is by keeping patients who are on ARVs on consistent compliance on their treatment schedule and not have it interrupted. So there is an importance to have an uninterrupted supply of ARVs in order to keep the viral resistance at bay. So that's the third element that relates to global health security. And then the fourth one is looking at the cost of treatment overall. So the cost of ARVs has come down over the years significantly, and if patients are consistently on ARVs, then they often do not have any serious opportunistic infections that require additional treatment. So by keeping patients on ARVs, you're also saving the cost or saving money that you would have otherwise spent on treating opportunistic infections. So that's the fourth level why we need uninterrupted supply of ARVs in the country. And of course, the fifth is in relation to the patient's overall well-being, including their mental well-being. I think it's a heavy toll already to be on long-term treatment, and patients on this long-term treatment, can very well do without the additional stress that comes with always being worried about their next dose and the risk that opportunistic infections would flare up because treatments are interrupted.
Early this year, the country grappled with an acute shortage of ARVs following a row between the government and the United States Agency for International Development over the channel of importation it used that saw a cargo of ARVs worth 2.1 billion shillings held at the port of Mombasa.
Counties with high stock of HIV/AIDS commodities are now considering redistribution to other counties with low stocks. And we thank them for this consideration, taking care of one's brother and sister. All county governments will ensure withdrawal of obsolete regimen, such as nevirapine, from the county facilities. The Council of Governors will engage the Ministry of Health to fast-track the release of pending products for HIV/AIDS stock at Mombasa Port.
I think we have gone beyond that in the negotiations with USAID. I think things are on track in terms of releasing those ARVs so that they can reach those people who need them. There was a point, of course, that this idea was being mooted, but I think we have gone beyond that. So we should be able to see these ARVs reaching people in due time once the negotiations and the paperwork is completed.
The stalemate forced public hospitals to ration the drugs, leaving patients at risk of not adhering to the medicine they so much need in a bid to live a normal life.
Healthcare workers tell us that by the end of April 2021, there will be no HIV commodities. And what do we mean? ARVs, the first line of ART, the TLD that is currently being used in the country. Usually people get a 3-month dosage. Right now, if you're lucky, you get 1 month, but if not, you get 2 weeks dosage.
Much as we acknowledge and appreciate the efforts being made to try and flatten the curve of COVID-19 infection, we do not want these other diseases that are also very serious cases and killers like HIV/AIDS to be overlooked.
There are multiple fronts to this. I think, if we think about ARV treatment and the supply chain and the entire, pharmaceutical value chain in Kenya and in many low and middle income countries, there are several, structural deficiencies within that supply chain. One is that oftentimes the manufacturing base is not in the country where the medicines are being consumed. So in the case of Kenya, you have patients in Kenya, but you're producing a lot of the ARVs outside of the country. So that creates a vulnerability in the supply chain. And then the second one is that there's a very significant price buildup in the overall pharmaceutical value chain. Our work shows that that price buildup can be as high as 400%, meaning that medicine that was $1 at the manufacturing site can become $4 or 4 shillings, by the time it gets to the patient. So that's a 4-fold increase in the price, which is significant. And you really can't control that if you're not in some way or form in control of the value chain. So by starting by having your own in-country self-sufficiency, you begin by having a good starting point in terms of controlling the price and therefore controlling the affordability. So that's the second point. The third point is that there is a spillover economic benefit of having local manufacturing. Of course, there is the immediate benefit of creating employment, prevent or reducing the amount of forex exchange that you would otherwise have spent in importing medicines from other countries, and that is an important part, given Kenya is one of those countries where our trade balance is still not optimal. So if the more we can keep our local production in the country, that will be that would be the best. And then, of course, in the long term, it's I mean, there are many initiatives to find a vaccine against HIV, and many other interventions are coming. But I think it's fair to say that ARVs will still be a key part of control of HIV and AIDS in the long term, at least for the next 10 years or more. So there is this value in having local production, because we're not just talking about a year or 2 years, but really over several years to come, that the need for local production would work.
But what will it take for the country to ensure a steady supply of ARVs? Locally manufacturing the drugs, perhaps?
Local production is probably one of the most sustainable approaches to go in terms of manufacture of ARVs, and not just ARVs. I think manufacture of what we would consider essential medicines in Kenya. And essential meaning, all the medicines we need for the leading causes of morbidity and mortality, all the medicines we need for diseases that cause the most burden in the country, whether that is malaria, whether it's tuberculosis, whether it's the emerging non-communicable diseases, among others. Thanks.
Kenya depends on foreign nations for the supply of ARVs. And over the years, the country has grappled with an acute shortage of these vital commodities. And now, in a bid to ensure steady supply of ARVs in the country, the government is looking into local manufacturing of these drugs. Even so, a lot goes into the production of medicines like antiretroviral drugs that are life-changing for millions of patients globally, as explained by the General Manager of Universal Corporation, Palu Dhanani, a pharmaceutical company that manufactures ARVs in Kenya.
ARV production, as we all know, is mainly funded through the donor-funded programs, and quality is very key when you enter donor-funded programs. So to develop any one product is a very, very costly affair. It can be anywhere between $1 to $4 million per product, and time, plus the pre-qualification aspect. So that is enormous amounts of money to be spent before you get the pre-qualification.
A guided tour of the Kikuyu-based pharmaceutical plant to get a first-hand feel of how the vital drugs are manufactured shows the work that goes into coming up with a final product, a tablet that people living with HIV depend on for survival. Ideally, production starts with the mixing of the active parts of the medicine that helps the patient. This is also known as API, active pharmaceutical ingredient, that involves starting chemical reactions where mixing of solvents and chemicals happens.
Those machines there will imitate the stomach or the intestine, where then the final product is taken for analysis in that room, or HPLC, it's known as HPLC, where it's compared against a standard. And with that standard, we know that the product is 100% compliant with against the standard with the sample.
And how long can that take?
Depends on product to product. Some products can take up to 2 days or 3 days, and some can happen in a few hours. So it all depends on product to product. But specifically the HIV product, it's a very long process of analysis. It could take, a full analysis could even take up to 3 days to get right from raw material to the finished product, or even more. So these are stability chambers where the product actually stays in here it stays for 6 months because it's accelerated condition. And in these two other chambers, they stay till expiry of shelf life. And we keep on monitoring that till expiry. And that gives us the confidence that the product is good when it's out of the market.
Experts say the production, distribution and storage of any drug must be handled with the greatest care and adherence to strict regulations, safety demand and hygiene in a bid to ensure quality. There are a number of hygiene protocols that must be adhered to by everyone in order to ensure the highest quality of medicines to be produced. For instance, as a visitor, one must wear specific protective clothing for the various hygiene zones.
Quality starts from how you procure your raw materials. Before you procure your raw materials, we have to establish whether the manufacturer has the capacity and also follows all the procedures within the allowed limits as per international guidelines. Then when the raw material comes here, we do the full analysis of every raw material from impurities, related substances, and all the other aspects which are required as per the guidelines by the World Health Organization. From there, we come to the manufacturing process, which is also monitored throughout the entire process. If you just had one batch manufacturing record, every step along the way, right from the time it was, I don't know if you understand dispensing, up to when the tablet is specced, there are parameters to be set. In between, there are obviously quality checks which are performed in-house by the quality control or independent lab which is within the facility. After that, we conduct stability. So there's a lot more that goes into quality. So when we submit our dossier to the World Health Organization in Geneva, they assess all this. Eventually, they come and visit our plant to see that we are following all these procedures in the right manner. Only once they are satisfied is when we get the WHO approval for doing such products. That's as far as WHO is concerned. And private sector also follows similar procedures.
The demand for these life-saving drugs has been on the rise, and with the recent shift of mindset on how to ensure an uninterrupted supply, local manufacturing will with no doubt go a long way in countering challenges in the supply chain.
Clearly, local production definitely helps in creating access to the population, and especially what the world has gone through in these 1.5 to 2 years in COVID challenges. We can proudly say that we have supplied essential life-saving products to various countries within Africa in these 2 years where imports were a challenge. So it signifies how important production of local medicines is. And even if you see in the market today, there are so many imported items that are shortage because logistics has become a challenge, flights, sea freight, everything has become a challenge. But whatever is produced locally, even if the shortage is there, it will be very, very minimal because we've been able to bridge the gaps as a local manufacturer throughout this period. If we are looking at Kenya, I personally feel the first-line ARV treatment, the requirement would be about 30 million tablets a month. I don't think we have a challenge at all in supplying the entire quantity. So we have enough capacity not only for the country, but even a few countries within the region, if needed. So I'm quite optimistic that with the Buy Kenya, Build Kenya policy and the government support that they want to encourage local manufacturing, at least in the region as well, we will see a good demand of this product. The demand is already there. I think there are almost 20 million patients in sub-Saharan Africa that require this product. And each person requires a tablet every day. So the sub-Saharan market is about 20 million tablets a day. Clearly, it is going to be a big stepping stone. We have enough capacity as it now. As you saw, we have a totally new line installed, ready to deliver that product. So we are already gearing up to increase capacity towards meeting the demand. So as a company, we are ready to support government initiative of Buy Kenya, Build Kenya.
And just like any other business that exists in an open system that is impacted by internal and external conditions that are largely beyond their control, pharmaceutical companies have had to navigate a challenging and rapidly changing environment. However, the NANI is hopeful that with the Buy Kenya, Build Kenya policy, it will help in ensuring a smooth supply of the drugs.
The challenges mainly, I would relate them to, I think the commitment. And now with the Buy Kenya, Build Kenya policy, I don't think those are challenges. I think the government is fully aligned to buy local products, which not only will alleviate stockouts, but it will also grow the industry in terms of employment. Yes, and we still, to grow and create more accessibility, definitely some policy changes are further required. And a good example is right now we are in the VAT exempt status, where we were in the zero rated status. So if we are brought back to zero rated, definitely it will bring the cost of drugs lower. Because today we cannot claim back the VAT which we pay. It's built on the cost. So if that goes out, definitely we can still bring down further cheaper in future.
And now, Kenya, whose external financing makes up more than half of all funding for immunization, tuberculosis and HIV, hopes to reduce its spending on its AIDS epidemic through local manufacturing. Gloria Milemo, KTN News.